and 4.3% in Winnipeg. 62 cases as of 9:30 a.m. today, bringing our total number of lab confirmed cases in Manitoba to 34,549, and 5 new variant cases since Friday, all from Winnipeg and all the B117 variant. I'm just going to provide a bit of a breakdown over the weekend for case numbers. So on Friday, April 2nd, we reported 114 new cases. 2 were removed due to data correction and 1 death. Saturday, April 3rd, was 68 new cases and 2 removed due to data correction. On Sunday, April 4th, was 69 new cases and 2 deaths. Monday, April 5th, 66 new cases. And so I'd also like to extend my condolences to the loved ones, the families, friends, and caregivers of those who we announced over the weekend as well. A reminder that everyone over age 64 and First Nations people over age 44 are eligible for a vaccine, as well as healthcare providers, community service workers, and others. So please go to protectmb.ca to see a full eligibility list and to make your appointment. You can also sign up there to get a notification immediately when the eligibility criteria change. We see our test numbers, overall test numbers, drop typically over weekends, especially long weekends. And so, again, reminding Manitobans to get tested for COVID-19 with if you have any concerning symptoms. So even very mild symptoms, even if you're not sure, this is the time to get tested. We absolutely want people with even mild symptoms to isolate, but getting tested so we can find cases, we can do the contact tracing, especially when our numbers are where they are. This is our time to really identify cases early and get on that aggressive case and contact management so we can keep our numbers down as we're in this race to get vaccines into people's arms. So our testing capacity is well above the demand that we're seeing right now, and so same-day appointments are available most times, and most times we get our results within 24 hours as well. So even if you don't have an appointment, you can go to a walk-in or drive-through site, and wait times are minimal. So I'm encouraging Manitobans, even with mild symptoms, even if you're not sure, let's get tested. I want to reiterate the importance of not traveling for non-essential purposes. We can see the rise of variant cases in many of the jurisdictions around our nation, and so it's imperative that we limit our non-essential travel to keep our case numbers down. We do have a number of people who are exempt from the isolation requirements if they travel for essential purposes. So again, critical workers such as healthcare workers, if they're traveling for the critical purposes, then they're not required to isolate upon return. But this does not allow critical workers to travel for leisure without the requirement to isolate. So right now, very imperative that even within Manitoba, but especially outside of Manitoba, we're strongly advising people to avoid non-essential travel. If you do travel outside of the province, ensure that you're following the isolation requirements upon return. People who left the province for spring break, please follow our self-isolation requirements. Please get tested as soon as possible when you return, and again at day 7 and 10, please watch for your symptoms very carefully and get tested should they develop. But it's imperative that we continue to keep our case numbers down related to that variant, and by not traveling outside the province, that's our best way of doing so. So I encourage everyone to avoid non-essential travel. If you did travel for non-essential purposes, please get tested as soon as possible. Please follow our isolation requirements. Reminder that we do have the northern travel restriction in Manitoba as well. So even travel within the province. We're discouraging non-essential travel, just to continue to keep our numbers down for as long as possible as we roll out this vaccine. Warmer weather, we're going to have more Manitobans enjoying that outdoors. So we know that transmission is less risky outdoors. So if you are meeting up with people, outdoors is best. We do have group sizes that we need to be aware of. And again, and that's gatherings of up to 10 people on private property. And so we ensure that Manitobans are staying safe, gathering outside with reduced numbers, but certainly no one with symptoms. People who are symptomatic need to stay home, get tested, but really we don't want you gathering even outdoors with others. So, enjoy the spring weather, be active, be outside, but do remember those gathering sizes. The risk is lower outdoors, but it certainly isn't zero. We do see outdoor transmission here and in other parts of the country. So please stay home if you're sick. Please watch those gatherings. And even though our mask mandate is for indoor public places, even if you're gathering outdoors, I recommend wearing a mask if you're gathering with people outside of your household. And so I think that's all I have for today. I'm happy to open up to some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Radio Canada, Alexia.
Hi, Dr. Roussin. So I was wondering about the Mamawe Center, the rapid testing site. How important is it now to get tested before going north, and how can it prevent a potential third wave in First Nation communities?
Yeah, so I think it's quite important. We want to avoid non-essential travel, period. But people who are traveling, especially to areas where we know transmission is at increased risk. We have crowding issues, access to healthcare issues in these areas. So we want to be extra careful. That's why I have the northern travel restrictions and also this advice to get tested prior to traveling to the north. So I think it's important to try to keep numbers down, especially as we're seeing increasing proportion of our cases being related to variants. That we need to keep those variants out of our northern communities.
And when we will see consequences of the Easter weekend, do you already have an idea of what we'll see on terms of number of cases, maybe?
We will start getting an indication of that, within the next 2 weeks. I might not have a full idea of it until 4 weeks. The concern is if we had a lot of gathering, especially indoors, especially with multiple households involved, it's very likely we're going to see increased transmission. And because we've seen the variant cases here, if the transmission includes that variant, then this could be where we see our third wave begin. So I want to continue to remind Manitobans that we're not done with this virus. If we're gathering in large groups, if we're gathering in closed indoor spaces, gathering with multiple households, we're at risk to seeing a significant third wave here.
From CBC Manitoba, Bart.
Dr. Roussin, even by Manitoba's own pretty modest vaccine targets, we're missing those targets. Last week, your colleague, Mr. Botha, said that we would get 6,600 doses on average. Up until today, the last 7-day rolling average was about 5,200 doses a day. We're really not getting eels into arms very quickly. At what point do you begin to consider that we're now endangering the population in terms of creating a good environment to create some more of those variants of concern that you've been talking about?
Well, I mean, we definitely want to get, as much vaccine uptake as quick as possible. So there's no doubt about that approach. I would say our vaccine rollout is still largely dependent on the vaccine we receive. So we receive vaccines. Some of that is allocated to our partners. Our distributed model includes, pharmacies and the primary care clinics. Some of that includes First Nations. But the vaccine we receive, we get it into arms quite quickly, usually over that week. And it's so tight that if we don't receive the next shipment as expected, we run out of vaccines. So we're getting vaccines into arms as quick as the doses we receive allow. And we're relying on ongoing receipt of that. So we haven't reached our full capacity of the amount of vaccine we can deliver. We're just need those doses to deliver.
Doctor, I hate to contradict you, but what you just said was plainly not true. That statement that we get rid of them every week, we haven't been doing that. And last week, we didn't even get to the dosage. That 6,600 a day that Bota spoke about, that was less than the total allotment for the week, and we did not even get there. So we actually have, I don't want to talk about the numbers sitting in storage because some of those, of course, will get administered over the week, but we're not even meeting the 6,600 target we set last week. There was a goal to get up to 7,000 by the end of March. We're not even at an average of 6,000 yet. So at what point do you, as the chief public health officer, walk over to your colleagues at the vaccination team and say, folks, get going a little faster?
Yeah, so a couple issues with the statement there is one is, like I said, some of the vaccine doses are allocated to our partners, and then there's a delay in reporting of that. And so when we start talking about vaccine that's not administered in arms, some of that is a delay in reporting. Some of that is due to logistics with our partners providing the doses. But yeah, we receive our doses, and through what the vaccine task force has direct control over, we are allocating that, and each and every shipment that we receive, we require and are at risk of canceling appointments if we don't receive it. So as we receive more and more, we'll administer more and more. And as far as the specific question to me is, from day one, I've been obviously concerned that we get this vaccine out as quick as possible, and I'm tightly linked with the task force. And from all the data that we see from that, we're getting the doses out as we receive it.
From the Canadian Press, Kelly.
So the age of eligibility for vaccinations is remaining at 64, it looks like, and then 44 for First Nations. So what could be slowing it down from your perspective? Is it just the number of people who are at this age level? And are we still on target for reducing the ages as we expected?
Yeah, and so I think it just depends on the demand for shots. And so the task force is watching closely, and as they base the eligibility on the supply and demand, so it's constantly being reviewed, and I would fully expect that in the near future that age eligibility again be expanded. I can't comment on the specifics of that, but I do think that's going to occur in the near future. And I think we're going to be on target. It's like I say, is that if we receive the doses that we're planning on receiving, we'll keep our targets.
Our neighbours are seeing a stark rise in variants of concern both in Ontario and Saskatchewan. You're obviously discouraging travel, and we have travel restrictions in place. But while those numbers rise, will we still move forward with steps to open the province in coming weeks?
We have to be really cautious when you see this occurring around us. And then also here, we're seeing our test positivity very slowly creep up. We're seeing the UK variant here, the B117. So we need to be cautious. So we'll have further comment on the details. But we are in a race. We're in a race against our third wave that is pending. It's happening right now in other jurisdictions, and we're certainly not going to be avoiding that. There is a third wave coming our way, and it's just all that will depend on is how many Manitobans we can get vaccinated prior to it arriving here.
From CTV Winnipeg, Jeff.
Hi, Dr. Roussin. I know you've already touched on this, but I'm just wondering, are there any, I know it's only Tuesday, but are there any early indicators through enforcement or otherwise that there were, large gatherings over the weekend, too many of them, where you are concerned about a repeat of Thanksgiving?
I don't have much specific to comment on that. We think Manitobans had learned from our Thanksgiving weekend, and time will tell on how much we gathered over the long weekend. As far as specific enforcement, we'll have that enforcement bulletin out on Wednesday this week, which might have some more specifics on that. But as right now, we're obviously concerned. It's why we need to be cautious as these next public health orders are being reviewed, because we won't know the impacts of this weekend for at least a couple weeks.
The federal government is again saying that by the end of summer, anybody who wants a vaccine will get it. Do you agree with that? Is the supply, because they say they're now increasing the supply, based on what you're seeing with the supply so far, do you agree with that?
I think, certainly I agree with that if we're talking about first doses with the way we have planned out. I think if we receive the vaccine as we expect to receive it, then yes, by summer I expect every Manitoban who wants a first dose should be able to have one.
From CityNews, Mike.
Good afternoon, Dr. Roussin. With B.1.1.7, variant of concern we're seeing the most in Manitoba, can you explain exactly how that variant can affect children and youth differently than the regular COVID-19 variant? Is there any noticeable differences?
I think that there isn't, any solid evidence on that yet. We know that this variant has a increased affinity to the receptor in a cell. It's more sticky, so it's easier to infect our cells. And then we also know that it's more severe. We're seeing from other jurisdictions that younger people are having more severe infections. Younger people are getting admitted to hospital and staying longer when they're admitted there. Younger people are getting admitted to ICU and staying longer when they're admitted there. And so with youth, we know that with wild type and overall the younger children were less at risk of severe disease. They're less at risk of being heavily transmitting that virus. And with this variant, we'll still have to consider those effects.
And that kind of leads me to my second question. Is there any way you could tell us if there's any children or youth right now that are hospitalized with COVID-19 in Manitoba?
Well, yeah, we would know that. I don't have any specific data with me here today, but we can certainly report on that. I'm not aware of any significant admissions right now in that age group.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Roussin. You've spoken about the vaccine rollout, and you said previously that we're in a race to get these vaccines out. Can you tell us plainly, from a public health perspective, is the vaccine rollout moving fast enough to get ahead of COVID and the variant?
It's tough to conclude that right now because certainly if our numbers stay where they are for the next 4 to 6 weeks, then we are likely to have a significant number of Manitobans vaccinated by that time. If we are going to see a steep increase in cases, like we've seen in other jurisdictions, then we're going to fall behind on that approach. And that's why it's imperative to be cautious, that we should be optimistic. We see spring, we see summer, we have vaccines, we have effective and safe vaccines. So there are reasons to be optimistic. But for the next many weeks, next couple months, we need to still be cautious as we roll out more and more vaccine.
Okay. Yesterday, we saw the provincial test positivity rate rise to 5.1%. Today, it's at 5.3%. How much weight do you put on that test positivity rate, and at what point will it, be an indicator that we need to clamp back down on restrictions?
Yeah, and so we'll look at multiple indicators, and so test positivity is certainly one that we look at, especially if we have stable test numbers daily, test volume. And so we saw over the weekend the test volume was dropping, so it's hard to rely completely on the test positivity. So we look at overall cases, we look at test positivity, we of course look at the demands on the healthcare system. And then, as we get more and more, then we'll be looking at vaccine uptake as well. And so it's just one indicator. And so right now we'll just have to continue to see what that trend does.
From Global News, Brittany.
Good afternoon, Dr. Roussin. It's Brittany from Global News. For the past year, we've been talking a lot about the symptoms that people can look for when it comes to COVID. I'm just wondering, have we seen any symptoms that have become more pronounced or more widely reported, specifically with the variant cases? And we've also heard some other ones, we're hearing more, vomiting and diarrhea, and then some cases that are having abdominal pains. What are we seeing changing with symptoms, and specifically when it comes to the variant?
Yeah, and so we haven't seen a lot of change necessarily. So the typical symptoms, fever, aches, fatigue, runny nose, sore throat, cough, shortness of breath, the typical respiratory symptoms that we expect and have come accustomed to. We've, listed the GI, gastrointestinal symptoms, such as vomiting and diarrhea, for quite some time. And we would say that we, not necessarily those are increasing, but they are increasingly missed as concerning symptoms. And so we have seen outbreaks related to people who first presented with those symptoms who, didn't think of COVID because it wasn't really respiratory symptoms. So it's good to keep in mind for healthcare providers, for Manitobans, that even these GI symptoms, nausea, vomiting, diarrhea, can relate to COVID.
Thank you. And as we look at other provinces where we are seeing variants increasing at a much higher rate, we're also seeing jurisdictions that are going back to remote learning. Why are we not moving to remote learning when we are seeing numbers of variants of concerns within schools here to try to get ahead of the spread?
We've our answers are always that these things are not, nothing's ever off the table. We always want to use the means that are appropriate for our circumstances. And so we know that our education partners have done a tremendous job of keeping transmission to a minimum within schools. And so we're going to continue to follow that, as well as transmission just in a whole, as very closely. And so we'll adjust our public health measures as required. But right now, we're in a really a cautious place where we're continuing to watch things, where we're going to have to be really cautious as we look at these next public health orders.
From the Brandon Sun, Kimberly.
Good afternoon. Dr. Roussin, I have a question regarding the Brandon Super site. They seem to be experiencing some issues with their online booking for the vaccine. For instance, I've been made aware of a couple of people that have gone to Winnipeg when they weren't able to access the site, the online booking site in Brandon. And I'm just wondering if you have a comment about that.
Yeah, I don't have any specifics to comment on that. I don't have any details of a situation, and so I'll certainly discuss with the vaccine task force to see if there was an issue and what's been done about it.
Thank you. My second question is, could you please explain why the rural vaccine delivery is being delayed due to the lack of supply?
Yeah, again, I think that this is going to be best answered by the vaccine task force. I don't have any specifics I can comment on that.
From CJOB, Will.
Good afternoon, Doctor. 5 new variant cases today. I'm seeing another handful over the last few days. What can you tell us about where the variants are spreading? Is it mostly household, mostly workplaces, in the community, some combination of all those?
That's right. Yeah, there's nothing unique right now going on. We're seeing household transmission, which is a significant amount of transmission we see. We certainly see a transmission within workplaces, and we see cases that we can't link to anything what we would call community transmission. So we're continuing to follow it. Numbers are still relatively low, but we're going to follow those trends and do what we can to hold off this pending third wave.
Okay, thanks. Some of the figures coming out of Ontario are a bit concerning, but I'd like to focus on schools. Nearly a quarter have reported cases in the past 2 weeks, and dozens are closed at the moment. Do you see any lessons that we can apply here based on what's happening in the East?
The big issue is with this virus, if you see transmission anywhere, you're going to eventually see transmission everywhere. And so it's, the best thing you can do if you name a location, the best way to decrease the risk of transmission in that location is to decrease transmission everywhere. And so we just have to continue with our public health measures, continue with those fundamentals to keep transmission low. And that's the best way to protect schools. It's the best way to protect healthcare facilities. And so that's really our approach.
Our final reporter this afternoon from the Winnipeg Sun, James.
Afternoon, Dr. Roussin. The Premier of Ontario was calling the new variant a new pandemic. Do you think that's true?
Well, I mean, I think we're in the same the pandemic with the same overall virus. I think that's the real concern is that their third wave that they're seeing right now is having different characteristics than we saw in that second wave. We're seeing easier transmission. We're seeing a rapid rise in cases, and then we're seeing younger people with more severe outcomes. And so it's certainly a shift in the in the nature of this virus. Whether we characterize it as how we characterize it is probably less important, but it certainly puts us at risk, and that third wave is making its way here. It's just, can we hold it off long enough to have a significant amount of Manitobans vaccinated?
Yeah, just second question. How can you just estimate how many different types of coronavirus there are in the community at any given time? And how does the test differentiate between the COVID variants?
Yeah, and so are you talking about like the SARS-CoV-2 variants? Like how many of those? There's there's hundreds of them because there's these RNA viruses are constantly changing. It's only the rare occurrence where you get that mutation that makes the virus either more effective in some manner, and so we see those type things happen all the time. The testing that we do just picks out the specific mutations in the variants of concern. So there'll usually be a deletion of amino acids in a certain sequence, and our test can detect that. And so based on which deletions, which mutations they see, then we can have a good idea of which variant of concern it is.
Thank you, Doctor. Thanks, everyone. This concludes our media briefing.